Hello dear all. So in this lecture of history of medicine we study Ayurveda. It is nothing but our own Indian medicine. So let's study history of Ayurveda. Ayurveda is having very ancient history. It is from pre-Vedic period 5000 BC, where there was Indus Valley civilization. So all of us are well aware about Indus Valley civilization in Harappa and Mohenjo-daro. They are considered to be in pre-Vedic period, which dates back 5000 BC. So what is Ayurveda? Let's understand. Ayurveda is Ayu and Veda. Ayu means life and Veda means knowledge. Thus, medical historians admit that Indian medicine has played in Asia the same role as the Greek medicine in the West. Ayurveda originated in pre-Vedic period. Rigveda and Atharvaveda are the earliest documents for ancient Indian knowledge, wisdom, culture and science. Atharvaveda mentions two systems of medicine, magico-religious means charms and mantras. Pharmacology means the drugs were used for treatment of diseases on empirical basis. Empirical basis means on past experiences. These are the sacred books, that is Vedas. They are having they are written on the leaves. Leaves are used as paper. So ancient times the leaves were used to write. So the Vedas are earlier sacred books of India. They are taught by God to sages in the period of unknown antiquity. Ayurveda is considered as Upanga of Atharvaveda. Ayurveda is knowledge of life, and during the reign of King Ashoka, it witnessed tremendous growth. There are two key figures in Ayurveda, that is Charak and Sushrut. Charak Samhita is way back, dated in 1000 BC, and it compiled 600 drugs. Sushrut Samhita compiled principles and theory of surgery. Sushrut is called as father of surgery. Sushrut Samhita dates way back to 700 and BC. Sushrut is called as father of surgery. Charak Samhita and Sushruta Samhitas are landmark texts in medical and surgical fields. Ayurveda describes principles of maintenance of health. as well as therapeutic measures to treat diseases. According to Ayurveda, health is physical, mental, social, spiritual balance, and it is similar to WHO, that is WHO, World Health Organization. So, Indian culture way back in 5000 BC states the definition of health in Ayurveda as physical, mental, social, spiritual balance. It is one of the oldest system of health care which promotes preventive and curative aspect. This medical knowledge has been the work of ages. It has come from observation, generalization, analysis of hundreds of investigators. It has very important and interesting mythological aspect. It has a medico-religious aspect as well and a divine origin. Lord Brahma had said to have originated Ayurveda. Lord Brahma taught Ayurveda to twin physicians of gods Ashwins. They passed it to Lord Indra. Lord Indra passed it to different sages. They in turn passed to their sons and disciples. Dhanvantari is the god of medicine in Ayurveda, is an incarnation of Lord Vishnu and is supposed to be emerged from the milky ocean at the end of churning by gods and devils. So this is a mythological story. All of us are well aware. So this is about Ayurveda. So Lord Brahma taught it, this Ayurveda, to the twin physicians of gods Ashwins. Then it is passed to Lord Indra. And Lord Dhanvantari is said to have generated from the churning of the gods and devils and generation of the milky ocean, that is Amrut. So Lord Dhanvantari is said to have born as a result of the churning of oceans during tug of war between gods and demons. So we proceed further after the interesting history of how Ayurveda is existing. So Ayurveda has Atreya Sampradaya and Dhanvantari Sampradaya. They are the schools. So Atreya Sampradaya is related with the schools of physicians and Dhanvantari Sampradaya with the schools of surgeon. Ayurveda has two important key figures, Charak and Sushrut. Charak is the most popular name in Ayurveda and a court physician to the Buddhist king Kanishk. Charak Samhita has written famous treatise on medicine and it compiled 500 drugs. There may be slight variation in the era. So Charak dates about 200 AD. So in few references it might be a different era mentioned. Charak Samhita consists of the drugs which are prepared from plants, animals and of mineral origin. It describes also anatomy, physiology, etiology, prognosis, pathology, treatments, types, number of medicines, various types of medicines and compilation of 600 drugs. He knew the fundamentals of genetics also. He studied anatomy of human body and gave 360 as total number of bones. He said heart had one cavity. One can imagine that this knowledge is coming in 1000 BC almost, or here it is mentioned 200 AD. At that time they had the knowledge and mentioned about various points of the anatomy of human body. Sushrut is coming in 6th century BC. He is a father of Indian surgery. He devoted to surgery as well as medicine, pathology, anatomy, midwifery, ophthalmology and hygiene. He set fractures, performed amputation, excised tumors, repaired hernias, excelled in cataract operations. He performed 15 varieties of plastic surgery to human face. He mentioned 121 surgical instruments. Example: scissors, forceps, needles, syringes, scalpels, catheters, rectal and vaginal speculum. So again a brief revision. He identified 1120 diseases. He listed 760 medicinal drugs as well. 20 surgeon sharp instruments, knives, scissors, saws, needles, 101 blunt instruments. And he described incision, excision, extraction, bandaging. He described association of malaria and mosquitoes, plague with rats, phthisis with fever. Phthisis is old name for tuberculosis. So tuberculosis is phthisis with fever, hemoptysis, cough. He as well described anatomy and embryology. Ayurveda also started magico-religious practice and matured in fully developed medical science. Ayurveda considers life is union of body, senses, mind and soul. Living man consists of three humors, Vata, Pitta and Kapha. As well, 7 basic tissues, Rasa, Rakta, Mas, Med, Asti, Majja, Shukra. And it has 8 specialities called Ashtanga Ayurveda. So let's see the pictures. So this is how the picture describes Tridosha theory of diseases. It has a extremely high significance in Ayurveda. It's a foundation of the Ayurveda that health is balance of Vata, that is wind, Pitta, that is bile, and Kapha, that is mucus. So balance of these three, wind, bile and mucus, consist of health, and its imbalance leads to diseases. So there are 7 dhatus considered in Ayurveda, that is a structure of the body is built with rasa, that is tissue fluids, rakta, that is blood, mas, that is muscle, med is fat, asti bone tissue, majja is nerves and shukra, that is the sperms. This is Ashtanga Ayurveda. It is describing the various branches. So Kaya Chikitsa, that is internal medicine, Kaumara Bharata is pediatrics, psychological medicine is Graha Chikitsa, Jara Chikitsa is geriatrics, Shalya is surgery, Urdhvanga is otorhinolaryngology, Agadha Tantra is toxicology, and Vrish Chikitsa is sexology. Same. So Kaya Chikitsa, Kaumarya Bharata, Bhut Vidya, that is psychiatry, otorhinology, that is Shalya, surgery is Shalya, toxicology is Agadha Tantra, geriatrics related to Rasayana, eugenics, aphrodisiacs, which increases the sexual power. Human body is made up of 5 basic elements. So Ayurveda considers Pancha Mahabhutas, that body is made up of five basic elements: earth, water, fire, air, and vacuum. There is balanced condensation of these elements in different proportions to suit the needs of different structures and functions of body matrix. Food is composed of five elements which nourish the body after the action of biofire Agni. Let's see the picture. So this is considered as biofire Agni in the stomach, which metabolizes the food into the seven dhatus. This picture we already saw, seven dhatus, that is the rasa, rakta, mas, med, asti, majja and shukra. So the food which is eaten by man is metabolized by biofire Agni, and it is converted to these seven dhatus. So Ayurveda also believes that the body is made up of Pancha Mahabhutas, that is air, fire, water, earth and ether or vacuum. That is the very important again concept in Ayurveda. Health or sickness depends upon the presence or absence of balanced state of body matrix. Intrinsic and extrinsic factors cause disturbance in the natural equilibrium, giving rise to diseases. Treatment consists of restoring the balance of disturbed body matrix through regulating diet, correcting life routine and behavior. Drugs are administered, panchakarma is practiced, and rasayan therapy is also practiced. Diagnosis is done by general physical examination, pulse examination, urine examination, feces examination, then examination of tongue and eyes, examination of skin and auditory functions. Treatment is by physicians, medicaments, nursing personnel. Treatment is for the patient, and now we see the types of treatment. That is Shodhan therapy. Shodhan is purification treatment. That is important for clearing the poisons which are there in the body. So we call it as detoxification and purification. As Vaman is inducing vomiting, Basti is giving enema, Neti is clearing the nostrils, and Rakta Mokshan, that is by applying leeches, suck the faulty blood. So it's a concept in Ayurveda, that is Shodhan therapy. Shaman therapy is using palliative treatment like fasting, diet, sitting and oil therapy. Pathya Vyavastha, that is advising proper diet and restricting certain diet, which will be very much correlated with the individual patient. Nidan Parivarjan is avoidance of disease causing factors. Sattva Vajay is psychotherapy. Rasayan therapy is rejuvenation of medicines. So this is the picture of Shodhan, Shaman therapy, purification, detoxification of the body, administration of these herbs. Importance of diet in treatment is very much advocated by Ayurveda. It says human body is the product of food. Food is converted to coiled ras, then to blood, muscle, fat, bone marrow, reproductive elements and ojas. So the Ayurveda advocates herbs, advocates the proper diet, also advocates the psychotherapy. So this is the diet plan with Ayurvedic medicine. So it encourages the dietary intake of lot many herbs, spices, fruits, etc. So diet has very important aspect in Ayurveda. So that was all about the history of medicine of Ayurveda. Ayurveda is considered as Indian medicine and it has an Indian origin totally, and it goes way back in the pre-Vedic period of 5000 BC. Thank you.